Hello and welcome to Thinkermaker. We're going to see how NHS managers, even with tons of funding, have made a total fiasco and utterly squandered resources. Billions. So, in 1992, one NHS manager spent £20 million on an IT system which was incompatible with another NHS IT system. It was hardly used and sold for scrap. Here's the official Hansard record of the House of Lords debate on that sorry waste story. Pause here if you'd like to read. Such history repeats. Computer systems come and go, get replaced, and fail, or fail to be accepted, or both, at costs of millions and billions. In the last episode we highlighted management fetish for restructuring the NHS. Well, in 2011 came another one of those, and with it came another NHS-wide master plan for an £11 billion IT system to streamline everything with big data. But it got completely botched and abandoned. £7 billion of that got wasted. As everyone in IT knows, put rubbish in, get rubbish out. And that includes the assumptions behind logical systems and algorithms. Health staff were not properly consulted. And all the while, clinical staff became increasingly frantic and demoralised. The wrangling between them and IT professionals and politicians further decimates morale. Oh, and look, lots of emotions, and those are not measurable. In healthcare, that 50% called care, empathy, compassion, quality listening, and heartfelt interpersonal touch cannot be measured. It is never in the data. Since the 90s, NHS management has lurched towards a data is king attitude. But the usefulness of generated data depends on how we slice and dice categories of treatments, budgets, postcodes, conditions. Those categories depend on logic, which depends on assumptions. If sweeping assumptions are wrong, then data leads to disaster. 7 governments have made this mistake of overconfidence in fixing the NHS with a new IT data-driven system, causing homegrown British staff to repeatedly learn a new way, never attaining a cruising steady state, instead becoming collectively overworked, stressed, mistake-prone, irritated, tired, with crushed morale and knock-on implications for patient experience. Even Computer Weekly reported the poor communication. And what then? After 2012, more restructures, yay! 1, 2, 3, and restructures within the restructures. Again, I ask, how would you like it if I rearranged the rooms of your house every 3 years? Like this. And again. And again. And again. People really hate change being forced upon them, especially continuous change. So enough, let's stop torturing our caring people while throwing away precious tax funds. Look how those master managers spent £9 million on what should have cost £2 million. Bankrupting our NHS with more debt than some nations. With badly thought through financial structures like PFI, blurring the distinction between public and private and causing insolvency arguments. In comparison to all this, the petty theft of the 1980s, described in episode 1, was nothing. So much for their superior management and counting culture. Counting is okay as long as it doesn't result in disregard of the things that cannot be counted. So, if you think Parliament was in chaos from 2016 through to 2019 post-Brexit, then try the last 25 years in the NHS. Here's an original copy of a junior doctor's hours audit from 1994. Let's look inside. An 83-hour week, 7 nights on call, 3 weeks and 14 hours of sleep in those weeks. You do the maths. This is grueling stuff. And to top it all, they've made a profound mess by perverting caringness. Most youngsters who dream of careers in healthcare are dreaming of this: hands-on, human interaction, care. Not data entry. The human factor on the supply side of the health economics equation is devastated. Wind the clock forward to the COVID crisis of 2020. Is it any wonder that precious few former staff want to return? One of them says, "Nope, nein, niet, never ever going back." The next says, "I would rather shove a rusty 6-inch nail up my backside." Do pause and read the others. You see, caringness is at its best when care professionals deliver care instinctively and willingly, in a genuine, heartfelt way, combining knowledge, love and passion. It must not be prescriptive, but a prescriptive and contrived approach to caringness is exactly what we've got from the managers. Care doesn't work like that. The prescriptive approach is due to a combination of factors: misplaced business perception of patients as customers, and with that, patients have an overgrown sense of entitlement, forgetting the NHS is a public service, not a private luxury. And also extreme risk aversion in the risk-reward balance, arising from a growing litigation culture, along with data obsession and systems process mania, all of which makes for lumbering bureaucracy, which seriously slows things down. For example, this email on the left is from a doctor responding to the government's urgent call for retired doctors during the 2020 COVID pandemic. Read the reply from Health Education England. It says, "The Bring Back Staff project has been slow for many reasons. Bureaucracy. Take data safety. Very important. But look at the multitude of agencies and players involved in managing the risks. 9 layers. So bureaucratic." This list is from the Health Education England's NHS staff induction course. Staff must pass a test on this every year. So that's how managers have wrecked the supply side of the equation for the NHS ability to provide service. You saw how managers have increased the demands with a customer focus. The next episode will reveal how politicians have increased the demand side even more over the last 2.5 decades. Thank you for watching.